What's going on, guys? It's Patrick here with Men's Health Unscripted. I have a great guest today, Dr. Elizabeth Lombardo, sports psychologist and author. Her focus is to crush your inner critic for a life of purpose, fulfillment, and true success. So thank you so much, Dr. Lombardo. I know you told me to call you Dr. E, so that's what I'm going to do. But thank you so much for coming on, talking about some, sports psychology, other aspects of men's health with us. How are you doing today?
I am well, and I'm honored to be here. So thanks for having me.
Well, we're definitely honored to have you. You have quite the resume, and it's going to be exciting to kind of dive in a little bit. Can you give us a little bit of background? How did you get into sports psychology?
Yeah, so out of college, I went to physical therapy school. I was a practicing PT. I loved it. I thought this was my life. And then a one-legged man changed my life forever. So as a physical therapist, as you probably well know, it's not uncommon to have clients who have had surgical amputations for diabetic complications. David was one of such people. He came down to the gym, right? And I was going to teach him how to walk again and use this prosthetic device. And I was so excited to work with him. And he wanted nothing to do with me. He's yelling at me to send him back to his room. So I sent him back to his room. And later we did rounds, right, with the doctors and the nurses and the therapists. I'll talk about each client. And everyone agreed that David was struggling. That made sense to me. What confused me a bit is the attending physician, the guy who cut his leg off the day before, said, "I'll prescribe him Prozac." Now, you and I both know there is a time and place for medication, without a doubt. However, I was thinking, shouldn't we help him process this? Shouldn't someone talk to him about this loss of identity, this loss of a part of him, and kind of figuring out who he is and who he wants to be now? And so it was kind of that revelation of, oh, I'm that person. I'm supposed to be doing that. And, we don't all deal with surgical amputations, obviously, but we all deal with loss. We all deal with disappointment. We all deal with a life where we think it's going one way and suddenly goes another. And hello pandemic, hello hurricane, hello, any events that can happen in our lives. And I realized that what we all need are skills on how to deal with these situations. So I went back to school, and I remember my first week in psychology school, I'm madly taking notes as the professor's speaking, and something else hits me. Why do I have to get a PhD to learn this? Wouldn't we all better thrive if we understood, at least on one level, how our mind works and how to make it work for instead of against us? So that really became my life mission, to get this information out there and in bite-sized, what I would call digestible parts of how we can use the information. We have so much research in psychology, but how can we actually use it to transform and improve our lives? And that's really my mission. And so with that, when I got my PhD in psychology, the sports made sense. I did athletic training when I was in high school, when I was in college, and the whole sports psychology, it just makes sense because what goes on up here in our minds impacts everything that goes on out here. So what we're saying to ourselves, our mindset, our belief system is going to impact how we perform, whether it's in sports, whether it's in the corporate world, whether it's in a social situation.
Yeah, a lot of what you said in your background really resonates with me. As a former college baseball player, I put all my eggs into the baseball basket. You're there on a scholarship. I was there. I would tell my professors, I wouldn't go to class. And I would tell my professors, well, I'm not getting paid to be a student here. I'm getting paid to play baseball here. Not paid, but my school is getting a large sum of it being paid. So
where's mine? But that's another conversation.
Right. Right. And so it was tough for me to finally end my playing career. And it ended just after college. I kind of tried to catch on with independent league and do that. And I think that was kind of a struggle to grasp at the last little bit left rather than moving on. And I think a lot of athletes end up with that issue, is that you identify as baseball player, football player, athlete, et cetera, but you don't really know how to end that part of your life and move on. And I'm not trying to say anything bad about a lot of athletes, but I went back to school to be a pharmacist. I don't know that many former college athletes or pro athletes that go back to school and try to do something different with their life. So that definitely resonated with me. Also, the gentleman that had his leg cut off, prescribing Prozac, I actually got in a huge argument with one of my professors in pharmacy school because we had a standardized patient. Oh, what do you think should happen? And I said, shouldn't this patient be getting some kind of behavioral therapy along with their medications? And they said, that's not first line. Prozac, uniquely enough, was the drug of choice there. But it was very irritating. And some of my classmates were joking around with me saying, Patrick, chill out, dude. This is pharmacy school. We're talking about drugs, not all that. But unfortunately, that's really how our medical system is geared. Hey, this magic pill will take away all your problems.
Yeah. And I will not go into the research on that, but we know overwhelmingly that a third of people do well on a particular medication, a third of people do well on the placebo, and a third of people don't make an improvement. There's definitely a time and place for medication. My mission, though, is to help people understand what you say to yourself impacts everything that goes on out here. When someone is dealing with clinical depression, and that's different than being sad or just having a sad reaction to something. But when someone's dealing with clinical depression, they have a mindset, they have a way of thinking. In psychology, we call it the unhappy triad. It's I suck, life sucks, and it's never going to get better. And helping people, I think we're going to talk about this later, but rewire their brain, think differently, not in a everything's great kind of superficial affirmation kind of way, but really start to view and interpret the world in a different way. That is exactly what will help people have less depression. Same thing with anxiety, same thing with performance anxiety, social anxiety, any of those. It's what we're saying to ourselves that's perpetuating that level of what in psychology we call distress, emotions we don't want. And so when you can change your thinking in a way that's consistent and automatic, that's when everything starts to change.
Right. So let's talk a little bit about it's kind of the revelation that you had trying to get your PhD. You noticed that all this information was accessible if you're a healthcare professional or going to be to healthcare professional program, yet the average person doesn't have access to this. And it probably would benefit. So how did you strategize turning these large chunks of technical information into much more digestible chunks so that the average person can understand it and also utilize this in their day-to-day life?
I mean, it started with my clinical practice. I mean, when I was in school, I worked two different groups. One was people with cancer, dealing with cancer, and a lot of them were dying. So it wasn't like I could be like, hey, the way you're seeing things isn't accurate, because they actually were going to die. And yet there were still some things that they were thinking that weren't helpful to them. And then I also had another group. It was developmentally delayed individuals, IQ from say 50 to 75. And helping teach them these principles, which was such a great experience for me. So taking something complex and making it really easy to understand. And then I started realizing, hey, if my clients who have an IQ of say 65 can get this and apply it in their lives, then someone with say more of an average IQ, they can do it too. So really, it was first in my clinical setting, right, as the shrink with the typical couch. And then I decided to write a book. My first book was called A Happy You, Your Ultimate Prescription for Happiness. And it was I say my life has been changed by men who have their limbs amputated. So this gentleman, we'll call him Roger, he was an electrician. And he was an electrician. I was working at a major trauma center in Dallas, Texas during my postdoctoral training, I guess. And he had touched a wire that was supposed to be inactive. And it burned his body so severely that the doctors gave his wife the following option. We can let him die, or we can surgically amputate both of his arms, 4-quadrant amputation. So the decision was made to amputate both of his arms. I went in to help him deal, right? Obviously, he's feeling depressed and hopeless and helpless. And yet when I went in to meet Roger, he had a big smile on his face. What? And the reason he had a smile on his face wasn't because his arms had been amputated. The reason he had a smile on his face was because he was so grateful that his life had been saved. And he was so convinced that he was still here on this earth for a positive reason. He didn't know what it was, but in his belief system, he was left here on this earth to do something really important. That was his focus. So with that focus, guess how he felt? With that focus, guess how he interacted during his rehab? And with that focus, I know you know about psychoneuroimmunology, right? How stress impacts our healing. Imagine how that impacted his healing. So just that mindset could change everything. And so with that, I just remember thinking, if this guy could be that happy, like I should be that happy, right? And so I kind of went on this quest. This was at the beginning of positive psychology. Psychology used to be all about let's make people less depressed and less anxious. And then Martin Seligman came in as the founder, or the head of APA, and each president of the American Psychological Association has a theme for their year. And his theme was positive psychology. Like, instead of looking at how to make, not positive things less not positive, let's look at how to actually make things positive. So now there's this whole field of research that I'm sure a lot of people are familiar with, positive psychology, but really looking at how we can change our mindset so that we can change our lives.
I think that's huge, because I'm a huge yogi, and at my yoga studio, actually, it's the owner is one of the main teachers there, and she's very much so not against the good vibes only kind of idea, because that's not really always true. It's unrealistic, but a lot of people like to say it, especially in the yoga community. But I think the big thing is that she discusses gratitude so much. And then when we practice yoga, when we're halfway through, she says, how grateful are we? And the rest of the class says, to have a second side. As in, I'm grateful that I just worked out my right side, and I'm super grateful now that I have a left side. And a lot of this is resonating with me very much so, just listening to you and some of your experiences with your amputee patients, that the gratitude can really shift your mindset from a I have to I get to. Yeah. And that's where, I'm not saying it would cure depression or cure all these things, but that shift in mindset has truly helped me and helped a lot of my friends and a lot of people that we've been around. It's like, I get to do this. It's an honor to be able to do X, Y, Z.
And, I think some people hear that and they think, yeah, gratitude. Practice it. Like, truly implement it. And it doesn't take a lot of time. I always say, when was the last time? People always tell me, oh, I'm so busy. So I say, when was the last time you woke up and thought, I have not brushed my teeth in 6 months? Never. Like, no one does that, right? We might forget at night because we're tired, but no one goes 6 months without brushing your teeth. Why? Because it's a habit. It's just part of what you do. No one takes out their calendars like, I really would like to participate in better oral hygiene. Let me find a time when I can brush my teeth. No, it's a habit. And the same thing with gratitude. Gratitude is where we not just think about people, experiences, and events that we're grateful for. I always say we savor, we bask in that. You can do that while you're brushing your teeth. This doesn't have to take a lot of time. But what we know from brain scans is that when people experience gratitude, the stress centers in their brain reduce activity. That's huge. So it's kind of like taking a Xanax without needing a prescription, right? Now having the negative side effects. So while this may seem, I always say it's not rocket science, it's rocket fuel, right? It's not rocket science. Gratitude, yeah, of course that's going to make me feel happier, but start practicing it. Start practicing on a regular day. Every single time you brush your teeth, just ask yourself, what's one thing that I'm grateful for? And then experience it. Experience the joy, whether it's a loved one, an event you had. I live in Chicago and we're starting to get cold. And the other day it was still 70 degrees. I'm like, oh, like it was so great. So just start to experience those positive things. It literally changes what goes on in your brain.
I can say it would be easy to be grateful for running water, especially after the weekend that we had. We were down in Fort Myers, to talk to you a little bit off camera, but these people don't have anything. I mean, there are neighborhoods that are leveled. They don't even have a home. And it's very sad, and it's very humbling experience. And so for me, for the past, I think 36 hours, I've really been humbled and like, I'm so grateful that I have this apartment and I have running water and I can cook food for myself and all those things, because in 1 minute, a natural disaster, anything, your life can change. And if you keep the gratitude practice, you can kind of stay on a good track, even if some things really ruffle your feathers. So,
well, and that's the thing, I think a lot of times I write books about happiness. I'm annoyingly upbeat. You know what I mean? Like, that's who I am. I'll just share my story, if I may. My husband, the love of my life, we've been together for over half of my life. 8 years ago, was diagnosed with ALS, right?
Wow.
Amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. That doctor at the Mayo Clinic looked at me and said, take him home to prepare, right? No, like, consider this treatment. Here's a support group, right? Even here's some Prozac for you, Elizabeth, or my husband, none of that. And yet even with that, well, and then I'll tell you that the rest of the story. So 5.5 years, he was in the hospital for, I don't know, 85, 90 days, intubated and extubated 7 times. We finally trached him. He's on a feeding tube. He came home. Well, I don't know how tall he is now, but he was 6 feet tall. He came home weighing 101 pounds.
Wow.
So he's been home for 5.5 years on a vent, trached up, feeding tube, requires 24/7 care. ALS is a disease that progresses, not a good word, but causes decline. So now he is completely paralyzed. He can't speak. He can't eat. He can blink his eyes, and that's about it. So I share this not to be Debbie Downer, but to just remind people that regardless of what's going on in our lives, we can still practice gratitude. And I remember last winter, I live in Chicago, as I said, and so in the winter, 30, 35 below degrees, windshield. I remember walking my dog and thinking, dog he better produce because it is cold out. And I'm like, getting all angry. And I was like, oh, my husband would do anything to be able to stand up and take this dog outside. And it was like, I knew it, but I just like felt it. And I was like, oh man. So, it's that aspect of, if you lost it all tomorrow, what would you miss most about today? And if we all put ourselves there, not in a guilt place, but in a really gratitude place of, you're right. Like, when was the last time we really appreciated that we can take a deep breath? Well, sometimes it takes, a loved one to be on a ventilator to do that, but just kind of reminding yourself, there's so much there, even when stuff's going on, there's so much there to be grateful for.
Yeah. Thank you for sharing that. That's very impactful. We're sorry to hear about that, but
I say it allows me to practice what I preach even more. So yeah.
Absolutely.
And it's so interesting because so when I was a practicing physical therapist and I worked with people with ALS, so people with ALS, they are paralyzed, but their mind is usually pretty much intact, as is my husband's, and he can move his eyes. And we used to have a piece of paper that would have the alphabet on it, right? A, B, C. And so in order to communicate, you'd point to the letter and they close their, blink their eyes, and then you move to the next letter. It took forever. Well, now they have this thing called an eye gaze board. You're probably familiar with it. It's basically an iPad. So instead of using your finger, like we might, he uses his eyes. So he communicates, he still does all of our finances. He redid 2 of our rooms last month with a designer. So it's incredible what he can do. And again, those kinds of things that we feel so grateful that he's able to do really help us. And when I say us, we have 2 daughters and my husband. So it's very powerful.
That it does. It seems that way. But thank you again for sharing that. Wow, it's really impactful. I'm sure our viewers will get a lot out of that as well. So I'd like to move on to focusing on crushing your inner critic. I think that we talk about this a lot on this podcast, especially lately. We've really been on a crazy mental health kick, but
no pun intended, but okay.
Right. So we've been saying, kind of quiet the voice down that talks to yourself, because if you told someone else the negative things about yourself to them, so like if I said, oh man, I really don't like myself today, blah, blah, blah. But instead of me saying that, I said it to you, you'd probably punch me in the face, right? So why would you say something to yourself that you wouldn't say to someone else? And that it's hard to say, oh, that's not real, because you are feeling it for a reason. But to say that to say the negative things that you would say to yourself, someone else would probably get you beat up or cussed out or whatever it is. And that inner critic for a lot of people's got to go. So how are we going to crush our inner critic?
So I have at least 2 comments that I'll start with on that. First and foremost, our inner critic increases its volume the higher level of stress we have. Right? We probably had experiences where we're low levels of stress, things are going well, and we're like, yeah, good, I got this, right? But as our stress, or in psychology, distress is the negative aspect of stress. As our distress gets higher, that's when that volume increases, right? So when we're at high levels of stress, when things are going, when things are tough, maybe at work or in a relationship, that's when that inner critic gets louder. So, and I call that high levels of distress, I call that the red zone. The psychological red zone, not the football red zone. Although I'm going to do a video on why watching the red zone puts me in the red zone. That's a whole nother conversation. So the red zone is when we're at high levels of distress. If distress goes from 0 to 10, Red zone is 7, 8, 9, 10. And we think differently in the red zone than we do in the green zone. And we can talk more about that in a minute, but just be aware that where we are on our distress scale will really determine how loud our inner critic is and how much we believe it. So when you hear that inner critic, ask yourself on a scale from 0 to 10, where am I on my distress? And if you are at even a 6 or higher, so even before you get into the red zone, stop and do something healthy and helpful to get that distress down. Go for a walk, jump on the bed, do some push-ups, sit-ups, squats, listen to music, watch something to make you laugh. When you can get lower on the distress scale, then ask yourself, well, what am I saying to myself? Because you'll probably realize I talk about green zone, which is low levels of distress, versus red zone, high levels of distress thinking. And we think totally differently, right? We're I don't know, let's say we have a big presentation, maybe on stage, right? Red zone thinking is, oh, I'm totally gonna screw up. Green zone thinking is, I'm going to give it my best, right? Or I don't know, we're trying to be good about our eating, right? And we have a cookie. Red zone thinking, I ruined my diet. I might as well have the whole plate. Green zone thinking, I'm going to savor every bite and I'm going to take a walk later, right? So where we are on this distress scale will actually determine how loud our inner critic is and how much we believe in it. So that's the first thing. The second thing, I talk a lot about cheerleader versus drill sergeant. So if you think of a drill sergeant, I had the honor to work at West Point for a bit when I was a physical therapist. And so I also worked in a couple different veterans administrations. So if you think of a drill sergeant, what does a drill sergeant do? Yells at the soldiers, demeans them, puts them down. Why? The ultimate goal for a drill sergeant is not actually to hurt a soldier's feelings. The ultimate goal is for that soldier to be ready for combat so that they can perform at their best. That's why a drill sergeant is so mean, for peak performance. Cheerleader does what? Woo, you're doing great. What's the goal of a cheerleader? To help enhance peak performance. So I say that because if you can take a step back from your inner critic. Instead of getting sucked into it, take a step back, almost like it's a different person. I name my inner critic. Her name's Mitzi. So when I can say, there goes Mitzi again, then what I'm doing is, one, I'm not getting sucked into what they're saying. And two, I can then ask myself, if my inner critic had a positive intention right now, what might it be? So we walk by the mirror and we focus on what we don't like, right? Oh, you gotta lose weight. That's our inner critic. But what does our inner critic actually want? It wants us to be healthy. It wants us to be attractive, perhaps, right? Our inner critic beats us up perhaps before we have an important sales presentation or a presentation or an exam. Don't mess up. What does it really want? It wants you to be successful. So if you can hear the intention of the inner critic, as opposed to the means by which they communicate that, then you can actually use your inner critic for good.
I think that's very interesting that you name your inner critic. I have not heard that before, but I think just listening to you, I think that's maybe a good way to dissociate yourself from it a little bit too, is saying like, this is some other person that I don't really have to listen to.
Right.
And then also reframing how you think. Is it your inner critic? If they want you to lose weight or do well on an exam or on that presentation, they do want you to do well, but also at the same time, understanding where that's coming from. And I think, so how are you taking the opportunity to reframe some of these things? I think it's very easy to say, well, just don't think like that. But what are some
but we don't want to say don't think like that, because we know our unconscious doesn't hear the word not, right?
Right.
So don't think about a pink elephant. Don't think about a pink elephant's trunk. Don't think about a pink elephant's ear. Don't think about a pink elephant's body. What are we thinking about a pink elephant? So we don't want to not think about it. We just want to reframe it. And I'll give an example from research, because I'm a geek. In one of the biggest fears out there is speaking in public, right? Higher than the fear of death for a lot of people. So in the olden days, psychologists used to teach people to just relax. Just take a few deep breaths before you have that conversation or go on stage. And that didn't really work. So then we decided, well, what if we reframe it? Because think about it. If someone's nervous to have a conversation, whether it's a one-on-one conversation or on stage or in front of a group, whatever, there's certain physical symptoms that come out, right? Maybe sweaty palms, maybe racing heart. And when we feel that, it goes more into, see, I'm anxious, see, something bad's going to happen. So the other way to address it is to reinterpret those symptoms. Think about when you fall in love. Like, what happens? We get sweaty palms, we get racy heart because we're excited. And physiologically, fear and excitement, it's the same thing that's going on. So people who reinterpret that sweaty palms, racing heart, I'm scared, it means I'm going to mess up, to, ooh, I'm excited to give this presentation. I'm excited to have this conversation. I'm excited to share the information. Those people not only felt more confident when they were presenting, but when an audience who is blinded to which group they were in, right, the relaxation or the reinterpretation group, when the audience is watching those people, it's the reinterpretation group that actually is perceived as being better speakers.
Wow. It's very interesting. I had a coach one time say, do you feel the butterflies in your stomach? And we would say, yeah. And then I remember some of my teammates would say, no, I don't ever feel that way. I'm chill. And the coach was like, well, then you're not human, man. You're supposed to feel butterflies in your stomach. You're supposed to have that. And frankly, I've come to enjoy moments like that just because you don't get them as I've gotten older and deeper into my career and different things. Sports has kind of really helped me be able to sit in discomfort. Yoga has also been able to help me sit in discomfort.
That equals sitting in discomfort, don't you?
It kind of does. And so the thing is I like when I feel the butterflies, because that means I have to perform. And it's this natural signal that just pops up, and there's nothing you can do about it except how you interpret it and then how you use those feelings in order to get that presentation done. In our case, like we say, ask a girl on a date, etc.
Yeah.
The nerve-wracking things that people have to deal with is really those moments are the true moments to be at your best.
Yeah. And when we look at positive psychology, one of the things that predicts greater happiness is when we have a moderately challenging, meaningful goal. Moderately challenging, meaningful goal. So if it's too easy, not going to do it. It's too hard, overwhelming. But when we have something that's moderately challenging and is meaningful to us, that's when we really thrive. Interesting.
Yeah, I think a lot of people do kind of tend to gravitate towards the easier things to accomplish just because, this comes natural to me, this feels good. But where the difficulty in training, or that moderate intensity difficulty, is really where true growth comes from. If we're doing things that are too hard, we might get beaten down and then not try again. But if we're doing something that's realistic and attainable, I think it's important, because that way, we'll say weight loss. That's a hot topic a lot. Is if you're losing that pound a week and you're staying consistent and you're seeing results, it's great. Someone can stay on track. But if your goal is to lose 20 pounds in 2 weeks before summer, it's probably not going to happen. And frankly, it's way too difficult. There's probably a lot of not eating involved and probably a lot of really unhealthy behaviors.
Yeah, for sure. For sure. And when you think about, that notion of flow, we talk about flow a lot in sports, right? When you're just in the flow, and certainly it's in sports. But it's also, when I'm writing, sometimes I get in the flow. So we all can get in this flow. We need to have in psychology, we call it arousal. We don't call it stress, but arousal has other connotations. So
sure,
we need that optimal level of stress. That's why the subtitle of my book is Transform Your Stress for True Success, because we don't want to get rid of stress. We want to find that optimal level. And for some people, the optimal level is a little lower, right? They don't do so well with stress. For some people, they're the ones who, like more stress. They're the ones who, a term paper is due, they've had all semester and they do it the night before, but that's the way that it works for them. That's what gets them motivated. So realizing that stress isn't always a bad thing, and figuring out for you, what's that optimal level to get you excited, to get you moving, to get you to that next level.
Yeah, absolutely. Just to backtrack a little bit, what was the full title of your book? So, and where is it at? Because I really like the framework.
It's right here. No,
what is it?
It's called Get Out of the Red Zone, Transform Your Stress to Optimize True Success. You can get it on Amazon. It's a really easy read because I didn't want anyone to get into the red zone by having to read it. So it's super easy to read. It's really geared towards, the book itself is geared towards organizations. Pre-pandemic, US companies lose about $300 billion annually on stress because of absenteeism, presenteeism when you're there, but you're not really there, right? Healthcare utilization and turnover. I can't even imagine what that number is right now. But it really, so anyway, it talks about more organizational stress, but I use this, I have a practice, a sports psychology practice, and that's morphed into not only sports psychology, but also teen mental health, because our teens and our parents are really, really struggling. I have 2 teens, so I know. But even the concept of red zone, like right now, and I just had a call a couple hours ago talking to an organization about how do we talk about mental health, because mental sounds scary, right? We don't want to, I don't know what words to use. Red zone, what a beautiful concept. When people are in the red zone, they don't think rationally, they don't act rationally. We've all had a time when we said or did something we later regretted, right? That's the red zone. Or we procrastinate on a particular, task because we can't face it. That's the red zone. Or we have trouble focusing because we're so stressed out, or trouble sleeping because we're so stressed out. That's the red zone. We all go into the red zone sometimes. And so if we can have this language of, oh, I feel like I'm in the red zone right now, let me take a break. That is going to help our mental well-being. It's also going to help our performance.
Absolutely. I think the get out of the red zone is a very identifiable concept, especially now we're in football season, and then for our audience, I think we're a bunch of dudes. We love football, right?
Yeah.
So, and the red zone is really where in sports and football, the red zone is really where the big moves happen. That's where plays happen. That's where kind of everything goes down that is really meaningful for the game. So it's interesting that you have labeled it that and have given it that kind of identifier so that people can see, oh, maybe I like to say sliding off my edge, but in the red zone, same thing. So let's
and I'll one way to use this, I'm a keynote speaker and I'm a coach. So I did a keynote speech for a company. A week later, I met with the executive team, group coaching, what worked, what didn't work. And the CFO said to me, she said, once I understood what happens in the red zone to our brain. So in the red zone, instead of using your frontal lobe, rational thinking, we're using our limbic system, fight or flight. She said, and when we're using fight or flight part of our brain, we can't think rationally, we can't problem solve, we can't be creative, we can't calculate, our memory goes down. So she said, after understanding that, now before every single meeting, I ask everyone, including myself, where they are on the scale. And she said she had a really important meeting with her financial analyst. They were going to go over numbers and projections for the next year. Huge meeting. He was at a 9 out of 10, this analyst. She's like, I knew he'd be no good to me. So they postponed the meeting. They met the next morning. He was out of the red zone and they had a really productive meeting. So what's the message she's sending? Not just to him, but the entire company, right? Your mental well-being matters. We can work around it and not only still be productive, but be much more productive. And it gives a language that people won't feel offended by, right? It really destigmatizes and depathologizes mental health issues. If you have a body, you have physical health. If you have a mind, you have mental health, right? So it kind of gives us a language that I think more people are comfortable with instead of talking about mental problems.
Right. It is mental health, especially with the group, the demographic that we go after with men, is not really something they would like to talk about. It is a tough topic. I know when I've had a couple bouts in my life, and I've noticed that I don't want to talk about it when I'm feeling there. I want to lay in bed. I want people to leave me alone and say like, well, I'm going to work on this by myself, and realizing that you can't always help yourself. It's important to realize sometimes it takes another person, even if you're just spouting off and just letting it out and they're just listening. It really does help to have someone else help you, and it kind of bring things into perspective as well. Yeah. So I wanted to move on. We had mentioned neuroregenerative training, and in my mind, when I read that, I thought, well, the brain has it's very plastic. You can move things around. You can rewire your neurotransmitter or your neurons a little bit. And it's kind of goes back to reframing your thought process, reframing how you think about your day and days to come. So what exactly is neuroregenerative training?
Yeah, neuroregenerative training, NRT, it's an approach that I have created after working with clients for used to be over 2 decades. We're close to 3 decades now. But it really is about how do you rewire that brain? If you think about every thought or just nerves firing a pattern in a certain way. And in psychology, we have a saying, nerves that fire together, wire together. Nerves that fire together, wire together. What does that mean? It means the more you have a thought, the more you have it again and again and again, and it becomes automatic. So for example, if I said ABC to you, you might start singing the alphabet song, right? And why would you sing the alphabet song, right? You didn't come out of your mama's womb singing the alphabet song, but you probably heard it over and over as a kid. You probably sang it over and over as a kid. If you interact with children, you probably sang it over and over again as a kid. So it becomes so hardwired in our brain that even though it's not the legal way to determine if someone is driving under the influence, a lot of police officers, when they pull someone over, they'll ask people to say the alphabet without singing. Now, sometimes they'll ask you to say it backwards, but even a sober brain has trouble with that. But it's really hard for a drunk brain to say the alphabet without singing because it's so hardwired in our brain to do it singing. So what we want to do with NRT is to start to rewire our thinking. And this is where it goes. It's not about superficial affirmations. It's not about like, I believe in myself, when the other part of us is like, I really don't. But it's about starting to not only think differently, but believe differently, so that this new way of viewing the world, of interacting with the world, becomes habitual. And I'll share a story way before I went to psychology school. When I went to college, I was scared to death of the freshman 15, right? This whole notion of gaining 15 pounds. Now, one way to deal with that would have been, don't drink beer, Elizabeth, but that was not the approach that I took. I decided that I was going to exercise. And I used to say when I was in high school that exercise was like against my religion. I did not like to exercise, but I decided that not only was I going to exercise, but I was going to like it. I didn't know how this was going to happen, but I made this intention that I was going to start exercising and I was going to start to like it. For almost 20 years, I taught group fitness. So I literally rewired my brain. So I went from not liking it to doing it to having it be a part of my everyday life, something that I am so grateful to have in my life. And I liked it so much that I made it part of my career. That's the outcome of what happens when we rewire our brain. Now, I didn't know what I was doing at the time because I didn't have all these techniques, but it really combines cognitive behavioral therapy, neuro-linguistic programming, and a couple other things. I kind of mix them all up to help my clients on a conscious and subconscious level start to rewire their brain so that it works for instead of against them.
We had a while ago had discussed one night, we had a couple of our former military on the podcast, and one of the guys was a former medic, the other guy's a former Marine, and we were discussing a study that was conducted outside of the United States, kind of part in, part out. It was conducted with the Canadian military and the US, I guess just civilians that had said that they had encountered some kind of abuse in their life, like at home. So not combat experience, just abuse, things like that. And they had put them under CT scans and had actually noticed that the neuro rewiring that had happened from abusive relationships in civilians was very similar to the neuro rewiring that it had on Canadian military that were in combat in Afghanistan for an extended period of time. And that just shows how the brain really can rewire itself under stress and under certain circumstances, that it really was difficult.
I mean, that's that limbic system, that fight or flight mechanism that gets so activated. And what happens, again, like in the red zone, which is what happens a lot of times when people haven't dealt with trauma, they see things in a very threatening way. So they're scanning the environment for what's wrong. They're focusing on what's wrong. And if you think about it, it made sense evolutionarily. I mean, the reason, well, I don't know if this is the reason, I don't know who created the limbic system, but if you think about, for example, our cave ancestors, if they heard a rustling in the bush and they thought, it's nothing, they may not live another day. Instead, they went into the red zone, fight or flight, right? Get rid of the animal, get away from the animal. Once they were safe, out of the red zone they went. instead of the limbic system, they started using more of that frontal lobe. They could see things rationally, they could solve problems. What's happening with a lot of people, whether it's because of trauma, for example, from childhood, whether it's trauma from what's happened, with the pandemic, whatever it is, a lot of people are in the red zone and they're thinking in the red zone, which causes more emotions in the red zone, which causes more thinking in the red zone. And it becomes this downward spiral. And a lot of people are stuck there.
Yeah.
Until they get the training on how to rewire their brain. It's not a forever stuck. But a lot of times when I'm speaking to people and I ask them from 0 to 10, 0, no distress at all, 10, the most distressed you've been, what has been your average level of distress? When I'm doing this with audiences, people will come up to me after and say, I didn't even realize I'm living at an 8.
Right. And I think the other issue too is that it's hard to get out of that situation. Like you said, you don't know you're in that thought process, but also I think the negative self-talk becomes so intense that people don't want to leave. You become comfortable in as you would say, the red zone, and you don't want to go back to green, because what does green have to offer me that red isn't giving me right now? And I'm not speaking generally, this isn't my background, but just in my own experience, in my sports experience, in my men's health work, we've seen, we go out and we do things in the Tampa Bay area. We go to car shows. We go to where the guys are to try to talk to them. We're not reinventing the wheel. Eat healthier, go see your doctor, get mental health help. I mean, it's just go do it. And you would be so shocked at how many guys want nothing to do with us. They see us posted up. We've got games. I've got koozies, stickers, all fun stuff. And it's usually the wives that are like, go over there and talk to them. You have not seen to the doctor in like 4 years. They're pharmacists. They're cool to talk to. They're fun young guys. And it is like pulling teeth, Dr. E. It is so crazy to get guys to come talk to us.
Yeah. Yeah. And I think it's a couple things. One is what they're comfortable with. And there's a lot of people don't want to be uncomfortable. So even if the goal is to help them, that discomfort is it's too much for them. 1, 2, I think a lot of times people think, well, I've been successful this far acting like this, right? The angry guy who yells, but he's been successful this far, so I must be successful because of this, as opposed to, wow, maybe I could be more successful if I wasn't doing this. Then the other thing I see a lot is, not that they would admit this overtly, the fear of failure.
Sure.
The fear of failure, because if I try and I can't, and I used to see this a lot. I remember when I was in school and I was working with people who had major depressive disorder. And a lot of times they didn't want to try this cognitive behavioral therapy, the most empirically supported therapy out there, by the way.
Mm-hmm.
And I couldn't understand it. I'm like, it's going to help you. Why would you not do this? I didn't say it that overtly, but what I came to realize was a lot of people were so concerned of trying and failing, of trying and not getting better, and then feeling like a complete failure, that they weren't even willing to give it a try.
It is really difficult to make changes, and especially take a step outside of the comfort zone, because then I think you kind of start seeing the whole picture, and it can get rough at first. It can be bad, but I think that the things that have helped me are being able to understand that some of this, like, I used to care a lot about what other people think. Now, significantly less, because I realize most people have their own stuff going on. So that if I do something weird, we do a lot of funny stuff on the internet for men's health. It gets people engaged. They're like, you know what? Those guys are being silly, having fun. I can do it too. But at first, it's like, what's my family going to think? Like, I'm talking about prostates, it's kind of one of those things where it's like, I'm kind of hitting the undiscussed topics in men. Yeah. What are people going to think about me? And now I don't care, because we've gotten so many positive responses about, hey, I went to talk to my pharmacist about XYZ, or I, went and saw my doctor for the first time in 10 years. And little things like that bring us so much joy that at this point, I don't really care what anybody thinks about me, because I know for a fact we've received so much feedback on how we've helped, just with like social media and making funny, silly videos and doing the podcast, that it's all worth it. And frankly, no one's opinion matters. It really matters too much anymore, as long as we're still helping.
Yeah, well, that's great. I really applaud all that you all are doing. It's such an important topic. And I have something called I call it hot tub syndrome. So hot tub syndrome is the following. Have you ever put your foot in a hot tub and it was way too hot, so you had to take it out?
Sure.
Probably, right? But then you probably put your foot in and out, in and out, in and out, and finally feels okay. And you kind of do that dance with different parts of your body. And eventually you're in the hot tub up to your neck and you're like, oh, this feels so good, right? We acclimate to what is uncomfortable for us if we persist. So when you feel uncomfortable, realize, oh, this is hot tub syndrome. Of course, it's going to be uncomfortable at first, but if I keep doing it, it's going to become my norm. And now it's become your norm, right? It's no longer uncomfortable to be talking about prostates or be doing something silly because not only have you habituated to it, but you also are focusing on what's the goal here? Is the goal for this person next to me to like me, or is the goal to help really change a life? And when you focus on what the ultimate goal is, that changes everything.
Sure. And also I would say I'm pretty rebellious of a person. Just my group, they love it. But it's like, hey, we're going to talk about testicular cancer today. We're doing a project with the Testicular Cancer Society. Nothing. Silence, crickets, whatever you want to call it. And it just shows us that it's not, it's not the algorithm or anything suppressing us. And it makes people uncomfortable. They don't like it. But the persistence of it is keep talking about it, keep hitting that topic. Everybody wants to talk about testosterone and lifting weights and all that stuff. But when no one really wants to talk about cardiovascular health or cardiovascular disease and how to prevent it and those things, because it's not on the forefront of everybody's mind. And they think, well,
and yet cardiovascular disease helps enhance our sexual functioning.
Absolutely. It's all connected to your heart. Okay. And I forgot the doctor's name. I want to give him credit, but he said eat a diet that's good for your heart. If it's good for your heart, it's good for your prostate, and it's good for your sexual, function. And, our guys, they like hearing how to be better at sex. They like hearing about all the foods and supplements and all that stuff that's going to help. But when it comes to, erectile dysfunction can, in a lot of times, be a direct correlation of heart disease. It's tough to talk about, but it's the truth. And so that's why we like to put it out there. And if we don't get the run for it, sorry to hear it, but we're just going to keep chipping away.
I think it's great.
So,
and hey, let's talk about inner critic and how that impacts your sexual performance, right?
Oh yes, let's get in there.
I mean, that mind can be very powerful and enhancing sexual pleasure and diminishing any kind of performance. So yeah,
for sure. And I think we can hit this a little bit too. Is that when, let's say, someone has a bad experience, they really can take that with them, and if they weren't, like, maybe they were nervous or they weren't able to achieve full erection, whatever the case may be, they get nervous and they'll say, what if this happens again? And then they're in that position with their partner again. The mind at that point might put you in that situation of not being able to be ready sexually. And then this becomes this perpetual issue. Have you ever interacted with any of your clients about that? I know maybe you're
frequently. Yeah.
Okay.
Yeah. I mean, and it's a perfect parallel with sports psychology, right? If I'm working with a golfer who, messes a putt and then he can't get out of that mindset. So then when he's teeing off the next hole, when he's putting the next hole, he's still stuck on that mistake. Happens in the bedroom too, right? Oh, it didn't happen last time, or I couldn't perform last time. It sticks in their brains, and then that impacts physiologically what can happen.
Sure. And then also, just to go, stress is a huge component of sexual dysfunction. We can't be present with our partner if we're not getting the work done that we need to on our stress. That's releasing the wrong cortisol everywhere. You have just the hormones that really suppress our hormones to optimize physiological and sexual performance. And so it's not just the stress, but it's also what it's doing to the body inside.
Exactly. Yeah. Plus, sex drive tends to decrease when people are really stressed out.
Absolutely.
Yeah.
So, Dr. E, it's been great talking to you. Do you have any last points for our viewers? And also, where can they find you? Website, socials, all that good stuff.
So my last point is to realize, okay, so what we say to ourselves impacts what goes on out here. Can I tell a story as my last point?
Absolutely.
Okay. So my grandmother was a psychiatric nurse by training. She was a little crazy. Most of us in psychology are. Anyway, she was an incredible piano teacher. And she taught a course at the college level, despite not graduating from university, that she called How to Play the Piano Despite Years of Practice. How to play the piano despite years of practice. So what she would do is she'd work with her students and she'd get rid of the habits that they had formed that didn't work. She would teach them the habits that were the right way to play the piano, and then they practice the correct habits. And if you get rid of what isn't working for you, if you learn what really does work and you practice that, you cannot help but get better. Whether it's playing the piano, whether it's crushing your inner critic, whether it's staying out of the red zone, whether it's peak performance. So what my hope is that the listeners will realize that, hey, there are some changes I can make, and anyone can make these changes. When you get rid of what doesn't work, you learn what does work and you practice it. So that's what I want to say. You can go to ElizabethLombardo.com. That's my name, ElizabethLombardo.com. That's my website. And we have all kinds of resources there, as well as if you want to hit me up on social media, you can see my links there.
Excellent. So I'll make sure that we include all of that in the bio for our listeners. Thank you so much for coming on our show, educating our audience, and hopefully getting people out of the red zone.
Well, thank you. And thank you for all you're doing for men's health. I really applaud it. And it sounds like a lot of fun. And I'm looking forward to following you on social media.
Thank you so much. And Dr. E, everybody, hopefully, maybe we can have you on again. That was a lot of fun.